Hi, welcome to Checking In with Amy. My name is Amy Goldberg. I'm a registered nurse with Neighborhood PACE. PACE stands for Program of All-Inclusive Care for the Elderly, that being someone 55 years of age and older, who live in our catchment area. That area is East Boston, Chelsea, Revere, Winthrop, and Everett, Malden, Melrose, Medford, Stoneham, and the Boston's North End. The goal of our program, Neighborhood PACE, is to keep you living in your home in an active, safe manner. Today, my guest is Raul Vidude, who is a nurse practitioner here at Neighborhood PACE. Welcome.
Thank you very much for having me.
My pleasure. So we've never really talked on my program about any of the respiratory issues. So I thought we would start out with COPD and why it's important for people to know about.
Of course. So COPD is a very important disease to know. So it's the third leading cause of death in the United States. Almost 15 million Americans have reported that they have COPD. And more than 50% of adults with low pulmonary function are not aware that they have COPD. So that 15 million figure is likely much larger.
So we're talking about letters, COPD. So not everybody knows what that is. So tell me what it is, and let's talk a little bit about the anatomy.
Oh, of course. So basically, COPD stands for Chronic Obstructive Pulmonary Disease, and there are two major kinds of damage to the lungs that can cause COPD. So we're looking at chronic bronchitis and emphysema. So chronic bronchitis, the lung airways become inflamed and narrowed, and this can lead to a chronic cough that produces sputum, and this is a result of bronchial inflammation. Over time, chronic bronchitis can scar the airways and reduce airflow. With emphysema, there is damage to the air sacs of the lung, the alveoli, and we'll get into that in a sec. And this damage can also restrict airflow. As the lungs become more damaged over time, it becomes increasingly difficult to breathe. When the damage is severe, it may also become difficult to get enough oxygen into the blood and to get rid of excess carbon dioxide. But unfortunately, the symptoms of COPD cannot be completely eliminated with treatment, and the condition usually does worsen over time.
Tell me a little bit about the anatomy of the lungs. Maybe that would be an easier way for people to understand it.
Sure. So basically, when we breathe in, air goes in through the nose and the mouth. It goes down the windpipe, trachea. It branches out into the bronchioles, and eventually it reaches the alveoli, which are these air sacs that we had spoken about previously. So at the level of these air sacs, oxygen, which you breathe in, gets exchanged with carbon dioxide that's in the blood. So oxygen goes into the blood and then gets distributed to the rest of the body. And that's essentially what happens during breathing.
With COPD, participants, we call them, are going to find that they're having different symptoms that might not be so normal for their respiratory tract. So what are you looking for?
So the big symptoms here are shortness of breath or having trouble breathing, coughing, and this can be possibly a dry cough or what we would call a productive cough, and that being a cough where you're coughing up phlegm or mucus or sputum, as well as wheezing, which can be a bit of a whistling sound as you're breathing. And as the disease progresses, you can find yourself to become very fatigued as well with activities that normally you weren't fatigued with before.
And tell me a little bit about the risk factors, because with every disease there are risk factors. So what can we do to know those?
Sure. So smoking, of course, is the most common. So 80% of people with COPD have a smoking history. And the amount and duration of smoking contributes to the disease severity. So the more you have smoked, the higher your risk factor for COPD, as well as the higher the risk factor for worsening of COPD if you already have it. There are also environmental exposures, such as long-term exposure to air pollution, secondhand smoke and dust, fumes, and industrial chemicals as well. And very rarely, so we won't talk about it as much today, is the alpha-1 deficiency-related emphysema, which is a genetic cause of emphysema.
And just as a point of interest in regard to risk factors, right, at least at my house, there's pollen everywhere. So I wonder, does pollen make it worse?
Well, in a way it can. So when your body is exposed to allergens, you produce histamines, which can trigger increased swelling and secretions. And the swelling and secretions caused by histamine production increase airway resistance, coughing, mucus production. And the combination of severe allergy symptoms with COPD symptoms can lead to COPD exacerbation, which we'll talk more about in a little bit.
I know, because it's not a great thing when you're out there. And I don't have COPD, so I can imagine someone that does, how difficult it is for them to breathe. Let's talk a little bit about the diagnosis.
Sure. So if you're experiencing some of the symptoms that we spoke about previously, the most important thing is to speak to your primary care provider about those symptoms, and they can guide you on a track to whether or not you could potentially have COPD. If they do believe that you might have COPD, some of the things that they might send you to do are pulmonary function tests or PFTs. Essentially, these are, it's a type of test where you are breathing into what looks like a pipe, and they are measuring how much air you can inhale and exhale. So they're essentially testing to see what your lung volumes are. Because what can happen with COPD is that as a disease progresses, these lung volumes become smaller and smaller. So you might also see that they'll be checking your oximetry as well. So that's a device that they put on your finger, which tests the oxygen saturation in your blood. This is a percentage, so it'll go up to 100%. And generally, we like to see these numbers above 94, although it does depend on the person, because as COPD advances, it is possible for someone with advanced COPD to, even with oxygen, have a lower than normal oxygen saturation, but that may be their normal. Possibly some blood tests as well, especially during an exacerbation or a flare-up, which we'll talk about in a little bit. And this just adds more information to the oxygen saturation and other information that your providers have. Exercise tests, so meaning your providers might have you walk for some period of time, check to see how much exercise you can actually perform before you become short of breath, or what you're limited to. And not necessarily for diagnosis, but there have been times when, through imaging studies such as a CAT scan, we might be looking for something else, and we might find that a person has the signs of what looks like emphysema.
That's a lot.
It
is
quite a lot.
It's a lot to take in. So that's how you diagnose it, and I know exactly what you're going to say, but I want to hear you say it. So how can we prevent this?
Of course. So more than anything else, it's important for people who smoke to stop smoking. And so what we need to remember with smoking is that, and I said it before, the more you smoke, the more years you've been smoking, the higher your risk is to have COPD. And everyone's a little different, you know? So we can't say that everyone who has smoked 20 years will have COPD. But again, the more you have smoked, the higher risk you have for COPD. And if you are diagnosed with COPD, the more you smoke, if you continue to smoke, then you're also risking advancing the disease faster than it should be. So there's also benefit in quitting smoking, even if you're already diagnosed with COPD.
Can it be reversed? Say I stop smoking.
So unfortunately, it can't.
Okay.
So with COPD, the damage that has been done to the lungs has already been done. But we do focus our efforts on trying to prevent further damage, because that is what's going to help you live a longer and happier life.
So people really have to listen to you. I mean, this is major. I mean,
I like it when my patients listen to me, of
I know,
course.
of course.
Yeah.
But we can't say it enough. It's
Sure.
almost like it goes in one ear and out the other for a smoker. You know, I'm
Sure.
happy and I want to smoke, and if I die of something with respiratory disease, so be it. But then when they get it, a disease that progresses, they're very upset about it, you know, and then there's no going back.
Right.
So if we can get one little point across today, that would be good. You did mention the word exacerbation a couple of times, pretty big word. So I know another word for exacerbation would be a flare-up. So let's talk a little bit about that.
Sure. So essentially during an exacerbation or a flare-up, what's happening is that a person is having a sudden worsening of their COPD symptoms. So this is the shortness of breath, this is the cough. With an exacerbation or a flare-up, you might see an increase in production of phlegm or sputum. You might see some color changes as well. You might generally just not feel well. And this can typically last for a few days, or it could potentially last for a few weeks as well. As far as what causes these exacerbations or flare-ups, so it can be related to an infection, be it either caused by a bacteria or a virus, or potentially by environmental pollutants as well. So if we believe that the exacerbation or flare-up is caused by an infection, then we will prescribe antibiotics. And the caveat that I will give with antibiotic use is that we also need to consider that the more we use antibiotics, the smarter bacteria become.
Right.
So we do need to keep that into consideration, because there is a limit of how many different antibiotics we have. We also use steroids as well. The most popular one is prednisone, although there are others, and nebulizers and inhalers as well. And so these are medications that you would breathe in some fashion, and they go directly to your lungs, and they help open up the airways, and they help you breathe better.
And so we have specific goals for treatments. So just simply, what would be your goals of treating someone with COPD?
Right, so we mentioned before that with COPD, unfortunately, you can't reverse the damage that has already been done, but we can try to prevent further damage. We also want to decrease symptoms, because we want our patients or participants to be comfortable. We want to reduce the frequency and severity of the exacerbations or the flare-ups that we talked about. We want to improve health status, and by that what I mean is that if a patient or participant has other problems as well, such as heart problems, or diabetes, we want to help control these other problems as well, to contribute to the overall health of the person. We want to improve their exercise capacity. So even though the damage to the lungs has already been done, you can still work with rehab or physical therapy, occupational therapy, to try to increase your functional capacity or the activities that you're able to do during the day. And ultimately, we would want to, again, help you lead a healthier and happier life, if that is your goal, to prolong your life, life prolongation as well, through the prevention of the advancement of the disease.
So some common treatments that you were just touching upon?
So as I've said before, smoking
Yeah.
is a significant contributor to COPD. So anyone who smokes should talk to their providers or clinicians about how they can quit smoking. There are several treatments as well. The most important thing, of course, is to remember that you have to be willing to make the effort as well.
Right.
During advanced disease, sometimes participants or patients will need oxygen as well.
Right.
We mentioned rehab, doing exercise, increasing your functional abilities, vaccinations, specifically to prevent respiratory disease. So there are two vaccines out there that help prevent pneumonias, and those are the Prevnar 13 and the Pneumovax. So those are a couple that we look to vaccinate people with. As well as, it's always important to make sure that you get your annual flu shot as well.
Right.
And the caveat with the flu shot is that we all have to remember that when we take the flu shot, we're not just taking it for ourselves, but we're also taking it for our loved ones and our community, because it's not just about making sure that I don't get the flu, because I may get the flu and I may survive the flu, but I may give the flu to someone else who may not. And that's important as well.
Right.
So lastly, I'd like to touch upon the medications as well, and I'll try not to get into too much specific information. But generally, the medications I like to lump into a couple of categories, and these are my generalizations. There are medications in COPD that we use to try to prevent the disease, and there are medications that we use as rescue medications when symptoms are worse. And I've noticed that sometimes people can confuse the two. So the medications that are used for prevention are medications that are meant to be used every day on a schedule to make sure that you try to prevent the symptoms of COPD. And the rescue medications are medications that you keep on hand just for when you need them, when it just so happens that you start to notice some of those symptoms coming back. And these are some of the things that I've noticed some people get confused with. And it's certainly something that if you have COPD, you would want to talk to your clinician, your nurse practitioner, your doctor about to make sure that you're taking your medications correctly.
So this was very comprehensive, I must say. So thank you very, very much.
Thank you so much for having me.
Time. And there's a few things that I want to stress to people. Number one, we do have respiratory therapists as part of Neighborhood PACE. We also have the ability to give you oxygen supplies and oxygen if you need that. This is all included in the program. Any kind of activity that you need to increase your lung capacity, we have that at the day centers as well as the wellness center. So it's extremely comprehensive. So if you do have COPD and you do have issues about it, for sure you should give us a call. The way to reach Neighborhood PACE is to call us at 617-568-6377. And along with many other topics that we've done over the time, I'm delighted that I hope today you will be able to take one little part of this home, and if you or someone that you know or love has any kind of respiratory issues, this might be a really good show for them to watch. So again, until we meet, please be well. Thank you for coming. Bye now.